I don't think people in the country like have a full consciousness of like the amount of developmental delay that happens with kids in this country, fundamentally related to like inappropriate nutrition. It's a variant of malnutrition. It's not just obesity engendering, it's like literally prevents effective brain development. And we are growing a massive population of people who are kids that never had a full chance.
And now, from San Francisco and the UCSF Rosenman Institute, the Health Technology Podcast with your host, Christine Winoto.
Did you blow your mom off about nutrition in high school? So did Jay Lengheier, our guest today. But now he's the CEO and founder of FoodSmart, a leading telenutrition platform. FoodSmart combines dietitian, meal planning, and food option in one platform. This combination makes it easier for people to get nutritious and affordable food, both for themselves and their families. Today, FoodSmart has over 1.5 million members and serving over 700 employers. Their goal is to eliminate food insecurity and malnutrition nationwide. And above all, to make healthy food accessible to everyone. But for Jay, getting there was a journey. Here's our conversation. Welcome, Jay. Thanks for joining me this morning.
Good to see you, Christine. Thanks for having me.
Yeah, it's a good sunny day in San Francisco, where we both are based. You have quite a collection of degrees from so many different amazing schools. But I thought before we dive into many different things, like, can you tell us a bit your maybe personal background, like your journey to get to where you are today? Why, start this company as well?
Sure.
FoodSmart.
Yeah. My personal journey, I grew up in a rural part of Buffalo. I think a defining part of my growing up was that I came from a blue collar, kind of lower middle class kind of family where, we didn't grow up in abject poverty by any stretch. And myself and my three younger sisters were like really loved by my parents. But my dad was a mechanic, and every time he got laid off, we would go on food stamps, and I had free lunches at school, and so that was like a part of growing up, was just going to 4 different grocery stores to hunt for deals with my mom every time we were in that kind of situation, and always felt like we had to be careful and spend wisely and be thoughtful about those things. So I actually feel really, I guess, an extra dose of empathy for what a lot of people are going through, but in terms of COVID and people getting laid off and furloughed from their jobs, and now the problems that people are facing with food inflation and inflation in general hits home. But connecting that to something else, like when the ethos of Buffalo is that like with 4 straight Super Bowl losses in the 90s, people had to stress eat chicken wings and other great Buffalo foods to just deal with all that. But jokes aside, like obesity is really prevalent where I'm from, and then kind of my family and circles kind of run in, and then with that, strokes. 3 of my aunts and uncles had strokes, before they were in their mid 50s, and my godmother and my aunt died of diabetes really young, and a lot of cancer, a lot of chronic disease, and a much shorter life expectancy than the averages in the U.S. But that just felt normal back then. It didn't feel normal after going to a place like Williams College and kind of seeing the rest of the country. So it puts a lot into perspective. And I guess the last thing I'd say, that was actually a very defining element of my upbringing, was that, my mom actually used to run, a local kind of version of something called Diet Workshop. It's kind of like Weight Watchers. And she used to take me. So it was like a number of women in their 30s who are struggling with obesity, 30s and 40s. And it's definitely interesting.
Hear the story.
hear their stories and just like it's a very emotional thing. It's not just like it's not like this cold calculating clinical thing like a lot of like medicine feels like sometimes, or it used to feel like. I think it's gotten better. But that kind of like gave me a real window into just how like much things like obesity and other things affect people's everyday life. It's not just like going to the doctor once a year or when you have a problem. It's all those things plus how it makes you feel. So, and then lastly, like my grandmother lived with us when she passed away. I was with her when she died, and I was in kind of in my preteen age, and so that's like a very important experience when you're growing up. And she smoked. She's a bus driver. Her husband passed away when my dad was only 17. So just like the weight of the world kind of on her shoulders, and she survived like metastases in her brain, and then kind of lived through a lot of agony, frankly, living in our house. But it was great to get that extra time with her, but it was also really messy, and just the way the healthcare system kind of handles that, the way society was kind of juggling that, and that gave me kind of a lot of perspective too about the flaws with the healthcare system, and inspired me to start volunteering at emergency rooms, start to get involved in healthcare and science. Biology was my thing and really loved it growing up. But also loved athletics and a number of things. But I just, from an early age, was like confronted, I guess, with mentors then when I started to go to the hospital that said, hey, medicine's really messed up. It's great. But don't think that being a doctor is like awesome and perfect. There's just so many systematic flaws that have built up. And one mentor that I had was like, you'd be better off being an engineer than being a doctor if you want to really have impact on a lot of people in the system. And what I took from that was like, hey, being a doctor, being a caregiver is actually really wonderful, and I love that today still. But it's also really gratifying if you can kind of step back and say, how can I fight through the systematic inertia, the politics, the systematic technical issues to try to like make it better for both patients and people and families, as well as for providers who just want to do good work and help people. And that's definitely been a key element of everything that I've done kind of since those experiences as a teenager.
That's really, and I mean, it's just, it's interesting that you're at young age. I assume when you're young, you're not overweight or obese because you're in the crew team, being dragged into obesity club. It must be quite an eye opening, and some of the story might be stuck with you.
Yeah, no, it's funny, like to reflect on like my own body and health. Like that was always like something of kind of a lot of introspection about that. I did a lot of like work later on in genetics and a lot of work in oncology. But it turns out that like, my mom and a couple of my sisters like have certain genes. One that I also have because we did our 23andMe, and I won't get into all the details, but like it actually affects women and it doesn't affect men, as an example. And obesity, diabetes, like so many other problems on other extremes like ALS, are usually multifactorial. Like it's a little bit of genetics, a little bit of environment. So again, you're in that environment where a lot of processed food and a lot of stressors, and then a lot of certain genes that then interact with hormones. Estrogen differently than testosterone. Like there's just an amazing amount of things that you can then see in hindsight where you're like, oh, that's why it is. Mm-hmm. So I feel really lucky that like, while I definitely have genetics that say that I'm more likely to be obese, huge kudos to my mom and that experience going to a diet workshop with her, where I would say we didn't have the best food coming into the house, but there was a lot of education, a lot of thought process. And so then as I got into athletics, football, lacrosse, crew, especially in college, which definitely teaches you to be disciplined with your body. Especially in college, kind of took all the things that I didn't fully listen to my mom about in high school. So I kind of survived with a really good metabolism and a lot of athletics. And then as I've gotten older, it was actually what my mom taught me, or taught me to at least be curious about. And then I kind of learned on my own, combined with all my coaches who, train you to be really disciplined. And I wish everybody in the world had those kind of support structures. I mean, if everybody had not just a primary care doctor, but a primary care dietitian, a primary care therapist, and athletics experiences, and families and education systems that gave them just a little bit more doses of these things, we'd all be a lot better off.
Yeah, no, I think you definitely hear that more on, at least I heard it from social media, like Tom Brady, he's a vegetarian, but he came with a chef, with the nutritionist, all the coach. And so it was like, okay, of course you can have that resources, then to make it easier compared to somebody don't have that access to a lot of the expertise like you're saying. So maybe can go back to, so you did go to college, you learn different environment, but you decide to still take the path of going to medicine in even though somebody's told you like you're better off being an engineer than being in medicine. Like, why is that path? And then how is that transition from all your work in clinical, also is like, okay, I want to start a company instead of staying in medicine?
Yeah. Yes, it's interesting. I was the first one to go to college in my extended family. And, the public high school I went to was great. I mean, it was actually a great education. Definitely like a suburban high school that was, well funded and had lots of AP classes. And I just got a lot of opportunities. I remember going to visit private schools and being like, there was such a wealth gap and it felt like uncomfortable to me. I actually didn't go to private schools specifically because the kids were talking about doing drugs and different things and leveraging wealth, and it just made me uncomfortable. So I stayed in public school, but I was lucky to be in a place where public school was really good and it gave you at least the option to kind of excel. But it was funny, other than like a kid here or there that went to Harvard, and a bunch of kids that went to Cornell because it was also a state school, I didn't even know what Yale and Princeton were. I mean, literally, when I applied to college, it was still in an era where it wasn't all online yet. And, my guidance counselors go to University of Buffalo. But I got this book award from a place called Williams, which I'd never heard of. People were like, "Is that William and Mary?" And I had no idea that it was a good school or anything. Just didn't have a conception of it. But I visited and I was like, man, I've been working really hard. Been working jobs, multiple clubs, playing music, doing sports, being a nerdy straight A kid. And I visited Williams and Harvard and Cornell and a bunch of places. And I was just like, wow, this place is beautiful. And it feels kind of it felt kind of like the movie with the funny movie Twins with Arnold Schwarzenegger and Danny DeVito, where Arnold Schwarzenegger was the good twin that got to live on a Zen island. Just Williamstown in the Berkshires feels kind of like that Zen island. I'm going to go there. And man, it's life changing, right? For so many kids, which is why I really appreciate how universities and elite universities, including Williams, are working so hard to give kids opportunities, especially kids that come from deeper poverty than even what I experienced. It's just so life changing for not just that kid, but for the whole family. And so Williams is definitely the start of it. And then there were people at Williams who chose also to kind of be professors there instead of at bigger research universities, but who had trained with Nobel Prize winners. And I remember one of my wonderful biology teachers, Dr. Altschuler, she trained with a guy named Lee Hartwell at Fred Hutchinson Cancer Research Institute, who was a Nobel Prize winner and, yeast DNA and genetics. And then, she just hey, called her old mentor, Linda Breeden, and I went out there and who trained with Lee and learned a ton, just in a summer internship. And all of a sudden I was like, wow, this is all the cool stuff I read about in high school biology. And now I was getting to do, research. But just that exposure, it sets off a cascade. And then I got to be at NIH for a summer with these like leading neuroscientists. And I kind of pivoted from cancer and genetics to kind of my big passion for neuroscience, because I always loved how, the brain and the combination of emotion and psychology and then the actual hardwiring of the brain and the mind works in the body. And it's just awesome. And then the senior thesis I did was an amazing professor, Steve Zottely. And so when all that was done and it was time to kind of think about, am I going to go to med school? That kind of voice in my head of that old mentor from the emergency room. By the way, that conversation where he told me you should be an engineer happened after a little boy, a 2-year-old boy, got run over by a car and passed away. It was the first time I saw anybody die like in real time. And he was the lead doc in the ER, who was my mentor, was really upset, angry, and that's when he was telling me, like, because I was barely knew him, but he's trying to console him, and he was like, "Oh, kid, you're better off being an engineer. Like, this is silly. These problems could be prevented." And he would always point out all the things that like should never even come to the emergency room in the first place. And that public health orientation, even though he was not a public health doc, just always stuck with me. So I ended up applying for the Rhodes and different things. And I was a finalist with the Rhodes Fellowship. But I remember, back to my grandmother, like I got a question from a journalist who said, "What's your take on euthanasia?" And I said, "Well, I think it's complicated." And I didn't give a straightforward, like, "Hey, no, that's bad. It's a slippery slope." I said, "Well, I think it's complicated. Like I saw my grandmother really suffer. And I just think that like, we probably need to rethink palliative care." And I wasn't like advocating, euthanasia straight out, but I just said it's complicated. And I don't think they liked the answer. But I ended up getting a fellowship to go to Cambridge, where I had done a year abroad. And so that was also a really defining experience. So I was in England for a year, my junior year, and I got to do medical school for a whole year in the middle of like Williams College. And it was so different in England, and there's such a NHS prevention orientation. So I picked up all those kind of things, and already had a bunch of medical training coming back to Williams. So I got this fellowship to go back, and I was going to train with this Nobel Prize winner in neuroscience. But then my dad called me and said, "You know what? Your sister, who had a baby with your best friend when she was 15 and had the baby at 16, you need to get a job and send money home." Okay. So my dad had never really asked me for anything. My parents were always like, "Okay, you do great in school, you do your thing." But it was the first time they ever really asked for anything. And so I switched gears, and my friends from the crew team got me interviews at Bain and Mercer and these consulting firms back in the era where it was just like, "Hey, you had a good GPA, they'll hire you."
Right.
So interviewed, got a job at Mercer, and that, which is now Oliver Wyman, that had, huge and profound impact on being an entrepreneur. So I'd done some business stuff in school with a thing called DECA, and I was like, "Oh, it's interesting." I got to like really meet people and other kids. It like actually made me from a pure introvert into like a combined introvert extrovert. But it kind of gave me some confidence to go do this consulting thing. But it's actually consulting that kind of completely opened up my eyes to like how you scale things. So when I was consulting, I started teaching myself how to code, and I took side classes on engineering. And then I ended up, my team on one of my projects passed away in 9/11. So I was literally flying a day later to New York, and I actually didn't because my team on the project was in the World Trade Center. So that was jarring. And I ended up pivoting to a different project in first the UK and before Australia for a pharmaceutical company, Bristol Myers Squibb. And it was about redesigning clinical research processes around the world, and it was a lot about technology and systems. And so that kind of opened my eyes to like how you do things on a systems level, how organizations are built. I did a lot of org design work with it, and it just completely changed my orientation to, hey, you can do research, you can do medicine, but if you really want to like have things change processes at scale, you also have to build a company, and this is how companies work. And that was just like the beginning of the journey. And then what really kicked it off is that inspired me to then do this fellowship that Oliver Wyman, back then Mercer, kind of helped support. And I, one of my bosses, a great guy, John LaRue, who now runs much of the kind of AARP medical programs. He connected me to this guy, Josh Sharfstein, who used to be at FDA, who had trained under a guy named Barry Zuckerman, who is just a wonderful advocate for children, had co-founded Reach Out and Read and Health Leads and a number of wonderful kind of advocacy programs for kids and families. And, I was there to just help with some like EMR implementation and other things. But he said, as a side project, if you're really passionate about it, you can help create this pediatric obesity clinic, teaming up with him and this woman, Caroline Apovian from the medical weight loss program, who's like a wonderful leader in that space. That was just an amazing kind of entrepreneurial experience, like helping like an esteemed health systems, but one that really helped low income families, put something like that together. One of my jobs was just enrolling people in Medicaid and SNAP, back then called food stamps. So then we kind of applied that logic to these kids and families, which were almost all on Medicaid, and help them kind of create these kind of personalized kind of grocery lists that they could afford on their food stamps budget, but that also fit their cultural preferences, their language and recipe preferences. And we just took a more gradual, gentle process. And we were really effective at reversing insulin resistance in those kids at that obesity clinic, because we just focused on the little things of like daily and weekly life within their budget. And that was really the culmination of all the things that I've talked about, is like, hey, you can build things like this. And then the next phase became, how do you scale them with technology?
This podcast is sponsored by Brown Rudnick's Global Life Sciences Group, a team of legal professionals that help life science companies, lenders, and investors around the world turn good science into good business. Learn more at brownrudnick.com. This podcast is also sponsored by Canon Quality Group. Canon Quality Group has been helping medtech startups set up quality management systems for over 10 years. If you're unsure when to get started with quality management in your startup, turn to the experts at canonqualitygroup.com.
Maybe you can tell us a little bit, what is Food Smart? What does it do?
Sure. So the Nutrition and Fitness for Life program at Boston Medical Center absolutely was the inspiration for sure. Together with like all the things I shared about just my background and seeing kind of what food insecurity and chronic disease related to obesity kind of does to families and communities. And then seeing what it really does for people in true poverty, and a lot of families at Boston Medical Center, living in Mattapan, living in Dorchester and Roxbury, like they're in much deeper poverty than what I experienced. And it's just really profound. I mean, kids that are like literally drinking soda and chips as their primary meals. And it's not, by the way, just about obesity. That's about frank developmental delay. And I don't think people in the country like have a full consciousness of like the amount of developmental delay that happens with kids in this country, fundamentally related to like inappropriate nutrition. It's a variant of malnutrition it's not just obesity engendering, it's like literally prevents effective brain development. And we are growing a massive population of people who were kids that never had a full chance. So it brought all these kind of things that I was connected to into much deeper focus. It proved to me that at small scale, if you pull the right elements together, a behaviorist, a dietitian, an endocrinologist, and you get really deep with the daily life and weekly life things, you can fix problems with lifestyle. And it wasn't like cancer, which, it wasn't incurable. And it didn't require crazy science. It required, like sitting with families and actually making a plan and making it personalized and specific and fit their budget. And doctors didn't have time for that. They would always say like, this is amazing. I'm told not to do that because I have to do 15 to 30-minute visits. There's no reimbursement codes. It's very complicated. And so they kind of saying like, if you could build tools that would just like deliver like a food script to people's door, like this Amazon thing that's delivering books. I mean, it was a long time ago. It was like 22 years ago. Then, you really could change the system. But there's just so much I didn't know. I wish I had all kinds of different mentors when I was younger, because I would have learned to code in high school if I could have, and I would have like built those tools right there. But I was like building tools on macros and then learning while I was in consulting, like, PHP and a LAMP stack, and then started to code. And then when I went to Duke, um, I had no idea, no mentorship, no structure whatsoever on how to approach it. But Duke was just starting up this entrepreneurial club, which is really cool. And then again, having no idea what I was doing, I both created this company called FitNet, a little LLC that started I started hacking together software and doing things, and met a wonderful woman named Emma Bunech from Romania, and she was at Duke doing her PhD in comp sci, and we kind of built this little thing, and she introduced me to friends of hers in Bucharest, and then we hired them to kind of help build out some of the next versions. And then I created this nonprofit called Fitness Forward, and went to Coach K, just like, hey, can we do this thing for kids, where it was kind of like the Book It program where you get stars for reading books, like where we can give kids and their parents points when they do different healthy behaviors, like no sugar added beverages and 5 to 9 fruits and vegetables. And we printed out these little Scantron scorecards and had a little web and mobile app and all these different things. And it was very effective in Durham, and we spread it to Boston and a bunch of states around the US. And that was that just helped me start to cut my teeth on being an entrepreneur, but in a really lightweight way.
I don't know about the lightweight. It feels like you have a lot of interaction with amazing people. I mean, nobody can know everything, but the time that you are, I feel like you've done many things. You're a Rhodes finalist. You do your crew, and you've worked with some Nobel Prize. I think you've done quite a bit. So go back to your Food Smart. So tell us more. Part of the Food Smart is you help the patient or the member to have a better access to nutritional food, and also do you also do help with delivering the nutritional food, the grocery list, including where you can buy the grocery? How do you make their life easier, especially for the food stamp family who benefit from the food stamp?
A good question. It's definitely been an interesting journey. So I actually, when I was at Duke, I went to the chancellor and asked for help, investing in kind of FitNet and Fitness Forward and advice. And he actually, the way he helped me is he said, hey, let's start a different company together. And I won't get into all that detail, but we ended up then co-founding a company called Preventus. And we were personalized cancer decision support with the National Comprehensive Cancer Network. Amy Abernathy, I hired to be our first CMO, and she went to do amazing things with Flatiron and the FDA. But I learned so much from Dr. Snyderman, Amy, and then the former CEO of Kaiser was on our board, and the former chief strategy officer McKesson. So it was just a crazy amount of learning. But I was the CTO and co-founder. So I kind of had put both FitNet and Fitness Forward on hold, and then I actually put med school on hold, and then I ended up going, when I kind of reintegrated back into finishing my MD, I went to Harvard School of Public Health on a fellowship because David Gergen, a wonderful guy, was on the Duke board, and they had this first year of a social entrepreneurship fellowship. So I went up. I was in kind of quantitative methods, nutritional epi, but I was also going to the Kennedy School, kind of learning how do you build companies, for profit or nonprofit, to have their focus be on impact, not their focus just on returns. And it was incredible, learning experience. Also, I met my wife at this wonderful conference that David took us to, with a bunch of nonprofit leaders like Wendy Kopp and others. So I'm really glad for that. My wife is amazing and runs a nonprofit called Pure Health Exchange. But I'm sharing all that because, if I hadn't had those experiences, it wouldn't have taught me how to go back and kind of build up FitNet the right way and turn it into then what became called Zapongo. And so then the Zapongo journey was, met my co-founder, Milo Krastev, from my best friend from college. They were working together at Value Act Capital. And Milo is amazing. He got an 800 as math SAT. He's a immigrant from Bulgaria, didn't speak a lick of English when he was 14, came to LA Unified Schools, also kind of similar economic background as me, learned English, became a Division I soccer player at Georgetown, and then just has this amazing mathematical mind. And then when we were first getting Zapongo going, we changed the name from FitNet to Zapongo. We were feeling our way in an era that startups were really starting to blossom again in San Francisco, and it was really fun. And so we first created kind of this like almost like a Lose It My Fitness Pal app, but then we realized that all the impact was coming from the nutrition pieces of it in terms of chronic disease. So we narrowed Zapongo's focus to be on nutrition. But our first instantiation was a B2C direct to consumer kind of app that was like Groupon for healthy groceries. And that worked really well. The problem was the way it had to make money was through advertising from the food manufacturers. And that became very uncomfortable very quickly because we would say, well, we'll pick these foods. And they said, no. This is the ones budgets. You got to pick these foods. And it's like, well, that's not our nutrition criteria. It doesn't work. So we dropped that model. And then Milo actually went off to Palantir. He got recruited away by some of the early leadership there and had an amazing kind of set of experiences there. I ended up joining Rock Health. And then this wonderful guy, Aaron Stortz, came to meet a bunch of the Rock Health crew. And he was at Google running kind of wellness. He introduced us to the Google kind of team. And then Google became our first really big customer. We'd actually done a Medicaid pilot study with AmeriHealth and it went really well. But it was really hard to get paid by Medicaid plans back then. But Google said, we'll pay you a good amount of money. And then we started to really build the personalized meal planning and the integration into kind of grocery and restaurant and meal kit ecosystem, but only as software in the early days, because white collar workers, like they crave software and tools, right?
Right.
Like,
they all have their own cafeteria also. So I almost feel like,
well, exactly. And you know what? That's where we got so much of our engagement at Google, because everybody opened up the menu on what was called Zapongo back then on the app. And it was before Google had built out all of their own internal tools on the digital menus. They kind of relied on the groups like Compass and others. And so we had this window where like people would come in every day to like Zapongo there and at other places. And then we had this, great relationship with Compass integrating with the menus. And we guided people to kind of pick healthier choices with that. Then we added integrations with all the grocers over time. And then we pulled in discounts from the grocers. And that was our first foray into kind of expanding from white collar populations to blue collar populations, because my North Star has always been to have this be serving kind of middle and lower income populations, not just kind of another kind of a white collar program that people subscribe to with their extra income. And so the kind of flash forward. So the journey to the Food Smart of today and kind of rebranding from Zapongo to Food Smart was that we wanted to support Medicaid members. We wanted to support Medicare members, just like that early study with AmeriHealth and the work at Boston Medical Center. But to do that, we had to be a telemedicine company. We had to be a telenutrition company, because health plans, as we started to cross over into kind of from employers to kind of the ASO kind of parts of big health plans like United, we realized that now you're serving blue collar workers and they need extra support beyond just like the apps. But now when you're trying to help Medicaid and Medicare members, like the apps are helpful. But the RD is the Sherpa, is the person that like helps you set up the grocery list online. And once you set it up, it's life changing because people keep using those experiences forever. So we shut off all the ads from the manufacturers, kind of like when you subscribe to Pandora or Spotify. Think of us like a kayak or an Orbitz layer over kind of grocery. And now today, over 300,000 restaurants, over meal kit companies, over medically tailored meal companies, we have kind of every way of eating kind of in our foods mart. But it took many years to kind of build all that out. And today, now it's about establishing a primary care dietitian relationship with a Medicaid member or a Medicare Advantage member, finding all the resources to support that person. Like especially if they're food insecure, do you have your EBT card? Do you need to re-enroll? Is there a food card program from ARPA money or funded by CalAIM and medically tailored meals money? Is there a medically tailored meal that you qualify for because you're post-discharge CHF or you're diabetic or fill in the blank? Are there other resources? What about price comparison? Since you can save $10, $20, $30, $40 if you go to this grocer instead of this grocer on this week. What about the coupon stacking, like our version of extreme couponing? So we do all that SDOH, food insecurity, food inflation, economics work first. We front load that. We get people set up with the infrastructure because our RDs and care coordinators are first and foremost customer support, tech support. It's like a flipped classroom. And then when you've got the infrastructure set up, now it's just like a machine, and you can just like have a relationship with the family and human beings and say, let's go on a journey. Let's respect the way you eat today culturally and just your local family kind of food culture. But then let's look at the things that are driving your obesity or driving your diabetes, like, oh, wow, a lot of soda, no judgment. Let's try flavored club soda. And instead of getting an ad from the food manufacturer, they get a little nudge or a reminder that's like, club soda, or how about this brand? How about this type? How about this type? And then when you find something that catches, all of a sudden you kind of roll with it. And that's kind of the food smart of today. It's fee for service telenutrition, but in working with the payers, it's also trying to kind of bundle up value-based food care where we make it easier for the health plans, especially Medicaid plans and Medicare Advantage plans, to say like, okay, how do I look holistically at the registered dietitians, the tools and the software of the Food Smart and the Food Mart, and the medically tailored meals and the grocery incentives that I outlay? How do I bring all that together?
I think that's really impactful. I can imagine. Usually I'm just, of course, assuming that people who does the grocery is the mother. Not only that the mother has to work, they have to take care of the kids, they have to do grocery, having a grocery list, things that make their life easier. And then you don't have to go different shopping places to compare prices. That also add time and costs. Moving from one grocery to another, you have to drive around to find a better deal. That is, if you can reduce all that, that make everybody's life easier. So last question before we let you go. What are the major lessons learned doing the Food Smart that you did not know, that you feel like, oh, that if I had to do it all over again, maybe I would do it differently?
Yeah, so many.
Just
and
few.
It's funny. Like I'm on a couple of boards, like the board of Partnership for Healthy America and the board of a startup called Synapticure with my friend who has ALS, which has been a hard journey, but just that he and his wife Brian Wallach and Sandra Abravai are amazing. But it's funny sitting now like as a board member and helping somebody start a new company. I mean, I wish I knew all the things that I knew back when I started Food Smart, because I would have just started a telemedicine company earlier. It's easy to say that now. COVID made so many things easier, no doubt. Snap Online, telemedicine you can use for people on Medicare. But nonetheless, I still would have done so many things differently. I've learned so many lessons from people like Glenn Tullman and Frank Williams on our board and Jeff Margolis and other people on how they do fundraising, how they organize the company, how they attract the right talent. But fundamentally in digital health, I think there were a lot of investors in the era that I was kind of revving up Zapongo that kind of pushed on applying models that worked in other parts of tech, like, high growth ARR with super high margins like SaaS. And I think we overdid that. And if I had like stuck to kind of my core and my roots earlier with telehealth and made it telehealth from the get-go, I think we would be a lot further faster. But it's okay. I mean, like it's a journey and I've learned so much. And I think we're in a wonderful position to help a lot of people. We help 1.5 million people today and over 750 companies, but we want to support at least 10 million people in the next couple of years. And we hope that in the next decade, we can help 100 million people, but also be just good stewards of helping shape the food as medicine industry and contributors to kind of like the telehealth revolution in general. So it's a privilege to kind of like be kind of in doing this kind of work. It's really cool.
No, it's really impressive. It's like what you do is so important. And I really appreciate your hard work in this space. But thank you so much for your time.
You're welcome. Nice to talk to you, Christine.
Thank you for listening to another episode of the Health Technology Podcast. We want to thank our executive producer, Herminio Neto, and our podcast engineer, Andrew Rojek. If you enjoyed this podcast, be sure to subscribe and leave a review. The Health Technology Podcast is available on all major platforms.